So last update to the board, you guys, was January 2022. So just a roundup update from me in terms of everything that's been happening. Let me keep an eye on the time for you, because I know we're running over a little bit. Okay, so Mental Health Continuum was launched in March 2022 via a joint webinar with ACE, and also at the 999 EMS Research Forum yesterday by Joe Mildenhall and Sasha Johnson. Great piece of work led by Jamie Wylam to develop this bespoke tool to specifically help ambulance staff to think about their well-being. It acts as kind of a reminder that well-being is individual and it's influenced by a range of occupational and non-occupational factors, and that mental health is fluid, and that we move between those different states, those different colours that you can see there: thriving, surviving, struggling, and crisis. And so the tool can be used either if you're on your own, or if you're with somebody else as part of kind of a check-in process maybe, and it enables ambulance staff to recognise the signs of where they might be at with regards to their own mental health at any time, and then also like what actions they can potentially take to improve things. So big thanks to Sasha and Joe for their contribution towards developing this with Jamie and ACE. We do continue to sit on the Employee Wellbeing and Suicide Prevention Group led by ACE and chaired by Will Hancock. They're continuing to do the oversight work, really looking at suicide prevention pathways for employees, suicide register development, and the work of the National Ambulance Wellbeing Forum and Wellbeing Guardians group. What's good about the group, it's got like a strong collaborative interdependency type theme, so it's all about joining the dots, which is good. I'm really up for that, and hugely valuable to ensure that the maximum amount of improvement can be seen from the work across different organisations, which is of course what we all want to see, that improvement. So moving on. Nope, have I moved on? There we go. This is the Future Workforce Mental Health Project, which I'm sure you heard about me talk about before. Funded by HE, been running for 12 months now. Gosh, where did that go? We will continue it for a few more months, 6 months or so, under the current funding arrangements. Emma Guys and Katie Bavoni, our two academic leads for this project, have done an absolutely outstanding job in delivering the project with real good energy and expertise, and within budget and to the original deadlines. So we've met all those contractual agreements with HE around the draft curriculum guidance. Well, it's now complete now, and we've got a RAP tool, which is the Work Risks Awareness and Play online tool, which is around reflecting, rather than reflecting on your clinical practice, like whether you should or shouldn't have cannulated a patient. It's more around reflecting on the emotional aspect and the psychological impact that going to a particular job or a particular patient might have. So that's almost finished. And the content for e-learning for health platform around learning and development package, that's almost done too. So that's fab. And now we're looking forward to kind of going a little bit above and beyond what we were contracted to do with HEE. So we're going to launch the kind of implementation phase of the project. So we've got Futurist Bright conference on the 19th of July. It's predominantly aimed at higher education faculties and ambulance service education teams, and anyone kind of with an interest in student education and wellbeing. So your preceptorship supervisors, your mentor type people, and that should be a good day. It'll be running alongside the AGM for those of you that are there. There'll be lots of people attending that conference, as well as another one that's running at the same time. We're also going to try, with HE support, a test to train the trainer type idea, which could potentially offer ambulance education teams a bespoke face-to-face learning and development opportunity in terms of how to embed the work that's come out of this project. So helping them along with it, which I do think is vitally important, isn't it? Because we could have just stopped. We could have just ticked the boxes, right? We've done this, now what? Move on. But that's not really what it's about, is it? So we're going to continue on and try and push into that implementation phase. Just a quick update on, you may remember me and Tracy there went down to London to the Royal Foundation Emergency Service Mental Health Symposium late last year, which saw all the organisations sign the Mental Health at Work commitment, this kind of landmark agreement which put a uniform set of standards in place for the mental health of emergency responder staff. So we're going to be taking the baton from the Royal Foundation to host a 1 year on event at Silverstone Racecourse. The Royal Foundation are really supportive of us and will be with us on the journey, so that's good. So the date for your diaries for that is the 23rd and 24th of November. Quick piece on just a publication that was done. So the Royal College of Surgeons of Edinburgh, Faculty of Pre-Hospital Care, they published this report with a series of recommendations around improving working conditions for emergency workers as part of a psychological care programme, and it calls on employers to take action to better support NHS staff that are experiencing growing levels of distress at work. And thanks to Jo Mildenhall for representing the college by being a member of the team that worked on this document, and she did that even before she was in her current role with us. So that's now been published on their website. I joined Tracy again in London at LAS to deliver a presentation to 200 of the LAS managers. John, you were there, weren't you, and Tim, at their sexual safety conference, which included, of course, the promotion of our fitness to practice representation offer and a reminder to people around the legal helpline for those considering self-referral. A note on self-referrals. So the average over the past 5 years, we've got some data back from HCPC, more recent data than we've had before, is 42% average. All professions, it's 18%. So that's 42% of all concerns received at the HCPC are via the self-referral route. But the good news is that what we're doing appears to be working. So there's a general downward trend, even though it's still high, relatively speaking, it's coming down. So we just need to keep going with that. 2020 did see the highest number of referrals to the HCPC from the public, up at 29%. I mean, 2020 was an unusual year, wasn't it? And there was some social media activity and TikTok use that we think might have created that spike in referrals from the public. But it's just something that we need to keep an eye on. We've always been very, very low in terms of public referrals to the HCPC. There's a newsletter going out to our liaisons soon with an updated version of the self-referral advice again, and reminding members that our valuable legal helpline is there for them. Wellbeing app is up and running just over a year now, and we continue to promote it via the usual channels and platforms that we have. We were able to welcome 87% to our national conference, so everybody could have a listen to what the data is telling us about our members and possibly more importantly about where we might put our focus in the future. The next date for a full review of all that data will be October 2022, so there'll be more information on that after that date. This is the latest COP logo book in the series that we have with Class Professional Publishing, and there's Jo Mildenhall went to support that launch with the authors Ursula Rolfe and David Partlow. I guess this book does focus entirely on how to better support the patient's mental health as opposed to the paramedics, but we know that the two are inextricably linked, so we're fully supportive of the publication of that book. And sticking with Jo, just a quick on the Rejuvenate Thrive Breathe programme. Hopefully you've seen the social media go out. The good news is that she's now succeeded in getting some links with counselling service in Northern Ireland to offer our members in Northern Ireland free access to counselling services, which they've been severely lacking in the past. So there's 3 centres in Northern Ireland, and one of them in particular will offer crisis support within a 48-hour window of a call. So that if Jo was here, she'd be really, really happy to tell you about the Northern Ireland piece. And of course, there's been lots of walks, and well, there's a wellness retreat that's been done by Mind Over Mountains, which is proved very popular for those using the mental health continuum to see where you're at, proving popular with those that are either surviving or potentially struggling. That would be aimed at them. And the many walks that we've had, so there's about 6, I think, across the country, not currently in Northern Ireland, but there's work going on to find a provider in Northern Ireland for something similar. The Black Dog, also mountain skills weekends in Snowdonia, have proved really popular, so the next one of them is September, and that is full already. There's feedback mechanisms set up with all the providers of these to ensure that we know what our members are experiencing and how they find these support offerings. So that will be looked at a later date. And just, I guess, finally, you know, we'll continue to work hard. Joe Milne-Hall has done fabulous work and should carry on for a little while longer on that variety of psychological support offerings. The range of mental health work might kind of decrease slightly in terms of its range, just while we focus on a few key work streams during the second half of this year, but I'm sure you understand why that would be. So thank you.